Journalism.
Well, here we are again. As of tomorrow, another COVID curveball sends Ontario back to a modified shutdown and us back to our home studios. So tonight we'll get the latest on the Omicron variant and how to cope with the pandemic fatigue with which we're all dealing. It's Tuesday, January 4th, and that's all ahead on the agenda. Exponential growth of the Omicron variant of COVID-19 means Ontario is back to a modified stage 2 with school closures, capacity limits, and more. With us for the latest on the medical side, we welcome in the provincial capital, Dr. Andrew Morris, professor in the University of Toronto's Department of Medicine and a consultant in infectious diseases and general internal medicine at Sinai Health System and the University Health Network, and Dr. Samira Mubaraka, microbiologist and clinical scientist at the Sunnybrook Health Sciences Centre. And then from the downtown core for the political angle, there's our pal Robert Benzie, Queen's Park Bureau Chief for the Toronto Star. Happy New Year, everybody. It's great to have you all on our program tonight, although I guess I should say we wish we were discussing better news. And let's start with a look at what the numbers had to say yesterday. Ontario's COVID-19 case count, big time spread. As of Monday, January 3rd, the Ministry of Health is reporting 13,578 new infections in the province. There are 1,232 people hospitalized with COVID-19 and 248 people in intensive care units due to the virus. And it's important to note that not all hospitals actually report numbers on the weekends, so we presume that the numbers actually might be higher than that. Now, Robert, let's put you to work right away. Give us the rundown of what the Ford government announced yesterday in light of these much higher new numbers.
Well, I think, Steve, to the shock of parents who had been told last week by Dr. Karen Moore, the Chief Medical Officer of Health, that schools would be reopening tomorrow, they found that schools are not going to be reopening until at least January 17th. Now, that's because the Premier says the numbers are so rapidly rising that they're worried about swamping the healthcare system. So they don't want to have people out and about in society spreading this. The danger is that now parents, or the frustration is that now parents have to find alternate childcare arrangements for some younger kids. They have to have their kids doing virtual learning for 2 weeks, which, given what we've all experienced since March 2020, we know that is an exercise in frustration for students, for parents, and for their teachers. So I think there's a lot of pandemic weariness, and I thought that the Premier articulated that yesterday when he was saying he understands people are confused, they're angry, they're frustrated. But he told us that he was presented with new evidence, which we hadn't yet seen, about how much this is spreading and how many cases there could be. Now, even though we know that thanks to research in Ontario and in Denmark and the United Kingdom and South Africa, that Omicron does not appear to be as virulent as Delta, they're worried about the healthcare system being swamped, and that's frustrating for politicians. It's frustrating for journalists, and it's frustrating for doctors and nurses and other healthcare professionals on the front lines who are having to deal with this at the same time as they're also having to scramble because there's absenteeism due to people having Omicron in those workplaces.
Right. Pick up on that if you would, Rob. Just a brief follow-up. That's the story from the education side of things.
Yeah.
What about businesses? What about stores, retail, et cetera? What's the story there?
So restaurants have to close to indoor dining as of midnight tonight, and indoor gyms aren't allowed either. So the Premier said that's just for 21 days. But the problem is 21 days can become 28 days. And I think there is I think for folks who have gotten their shots, gotten their boosters, downloaded their Vax passport, there's this feeling that, we did all of these things. Why are we now, is this restaurant not able to open if everyone inside the restaurant is vaccinated, because they have to show proof of vaccination to go into any restaurant in Ontario? So I can understand the frustration from small businesses and from Ontarians in general. I mean, people are, as we enter the third year of this pandemic, people are frustrated and exasperated and exhausted, and I don't blame them. But we have to remember this isn't just happening here. Ontario's had, by and large, a better pandemic than Quebec, Manitoba, New York, or Michigan, which are our neighboring jurisdictions, and I think that's a fair comparison. We've had a better pandemic, all things considered, than the United Kingdom, than the United States. So I think context is important. I understand people being frustrated. I understand their anger, but at a certain point, you have to say, we're not alone. It's like this everywhere, and in most places, it's worse.
Dr. Morris, can I get your view on whether you think the government has made the correct decision given the circumstances?
Yeah, I think they're in a really tough position right now. Obviously, any kind of action that you want to take, you want it to be taken earlier rather than later. It's always going to be more effective when it's taken earlier. The problem that the government faced is that there really wasn't the public appetite for any action before any kind of strain was being recognized. What we have right now is primarily a mismatch between healthcare worker supply and healthcare demand. That's the major strain that we're facing right now. And it's really unclear to me, to be honest with you, whether what was being proposed or what's being enacted is going to make that mismatch better or worse. We're going to be taking members of the workforce out of action because they're going to need to be taking care of their kids at home. And on the other hand, there will be some benefits probably by reducing transmission. I think they couldn't be seen by not acting. I would have preferred for them to be heavily focused on preserving the workforce and as much as possible trying to keep the rest of the public safe. But this is a very difficult tightrope to walk, that's for sure.
Can I get your, maybe you can help us understand better the question that Rob raised at the end of his last answer, which is to say, if everybody who goes into a restaurant has to show proof of double vaccination that they're safe, why are they shutting restaurants down entirely, given that the people inside those restaurants are presumably at the least amount of risk of society in general of getting and spreading this thing?
Yeah, well, I think a few things. First of all, that was probably a reasonable calculus 2 months ago, or maybe even 6 weeks ago. But Omicron has really changed that altogether. I have to admit, I'm one of these people who are now questioning the current value of these vaccine certificates for two reasons. One is we know that many people with Omicron are asymptomatic and yet transmitting. And on the other hand, we also know that because of what's happened with its resistance, Omicron's relative resistance to neutralizing antibodies from the vaccine, just having been vaccinated doesn't guarantee that you're going to reduce your likelihood of transmitting it to others. What it is doing is it's preventing you from becoming very sick, and that's fantastic. But unfortunately, I just don't think it's giving us the reassurance about preventing transmission.
Okay, Dr. Mubaraka, there's so much misinformation right now, particularly in the places where people traditionally get a lot of their information. And by that, I mean social media sites like Facebook. So we've got an honest to goodness expert here today who spent a lifetime researching this. And let's start with this. Can you talk to us about what we absolutely know about the severity of Omicron?
Well, like anything during this pandemic, there are no absolutes. So we always have to be prepared for things to change. I think that much is, that is absolutely clear. Anticipate change. But there are data that are somewhat reassuring in terms of severity that I think you mentioned at the top of the discussion. And we are seeing reduced hospitalizations, maybe around 50% compared to Delta. The problem is we're anticipating so many infections, is that even a small proportion of hospitalizations into a small proportion of a large number still translates to a lot of hospitalizations. Now, there is a lot of reassurance in the fact that there are some pretty good data that there is vaccine effectiveness against, especially with the third dose, against hospitalization. So getting the booster or the third dose can reduce the severity. So when we think about severity, we often think about hospitalization, critical illness, and death. So that can be reduced substantially. Numbers are a little bit variable, but somewhere in the realm of 75 to even up to 88% in one UK study. So that's really reassuring. And part of that, even though there is less neutralizing or lower concentrations of neutralizing antibodies, that's just one arm of the immune system. So there's another arm called cellular immunity. And it does look like there's some data in the last week, 2 weeks, everything's coming out so quickly now, that shows that T-cell immunity is still pretty robust. So that potentially may be why we're seeing less severity. There's also a study from Europe that shows that it can, even though I agree with Dr. Morris that, this is not, vaccination does not confer sterilizing immunity. There's always a chance that you will transmit, but the reduction in household transmissions is substantial enough that it could play in a really important part in at least blunting some of the transmission, especially with close contacts, such as households.
And let me do this follow-up with you. Is it still the case, as it was with previous variants, that there is a disproportionate number of people in hospital and in intensive care units who have yet to be vaccinated? Is that true?
That is correct. So unvaccinated or partially vaccinated. And one thing we need to bear in mind is that our definition of fully vaccinated is also going to change. And I think we're more likely to adopt terminology going forward, maybe calling, for example, third doses updated vaccines, because I don't think we're done yet. I think we need to prepare ourselves and socialize the idea that ongoing vaccination will be a reality here. And as many people know, some of the vaccine manufacturers are looking at developing and have already developed and are testing Omicron specific vaccines. We just don't quite know yet what the triggers will be to roll those out. I think we have a lot of work to do in that regard.
Robert, let me circle back to you. And again, I want to go back to the education angle here, because it was only last Thursday that the medical officer of health for the province of Ontario took to the microphones and said, we may need to start the school year a couple of days late, but basically it's all systems go and you're not going to have to put your kids through online learning again. It was only 4 days later that they completely changed their position on this and said, okay, things have changed. 2 weeks now, we need a real circuit breaker here. Can you get us inside that cabinet room and tell us what obviously transpired on Sunday evening when they were having their meeting that resulted in such a different position emerging from that meeting than from the week before?
Steve, I think what happened on the Sunday is that the Premier was shown some new modeling, and I would take all of the modeling with a grain of salt, just because the best, indicator of future behavior is past behavior. And we know that the modeling projections dating back to April 2020 have always been so wide ranging that we don't really know. Are there going to be 10 cases today? Are there going to be 10,000 cases today? At a certain point, it becomes really, really difficult to figure it out. But anyway, I gather that he was shown these projections that 1% of Omicron patients could end up in hospitals, and that as Dr. Mubaraka was saying, it would swamp even 1%, a huge number, would be very, very difficult for the health system to cope with. Now, I don't know where that 1% number came from as we do this taping, Steve. I'm trying to find out. But I haven't seen that in any of the studies that we've looked at from Europe and South Africa. So I don't know if it's 1% or if it's 0.1%, but whatever. He was worried enough that he went to the cabinet and said, look, this is what's going to happen, and we have to close schools. But the problem with closing schools is there's a cascading effect that comes from that, for childcare, for the kids themselves, because I think the mental health of our children is the thing that I'm worried about as a parent. What's it gonna be like for them after the pandemic? I mean, how are they going to cope? Online learning, and teachers and students and school boards have done a great job coping, I think, but it's not the same as an in-classroom, in-person experience that we all enjoyed when we were in school. And I think that's something that we really need to worry about. And I know that the Tories are very worried about the political ramifications, because parents are upset about this. They're upset that they got told one thing on Thursday, and then the following Monday they got told the complete opposite. And now when they say, oh, it's going to be January 17th that schools might reopen, I don't think anyone believes that that's going to happen because Omicron numbers are still going to be going up, presumably. I mean, Dr. Morse suggested that yesterday that it would hopefully taper off by the end of January, which would be fantastic if that's the case. But that doesn't mean schools are reopening on January 17th if it's still rising, you would think.
Well, let me go to Dr. Morris on that. Obviously, the Premier of Ontario is making decisions along with his cabinet based on the modeling numbers that he's getting from his public health experts. I guess the question I have for you is, how much faith should we have in those modeling numbers upon which these important decisions are being made?
It's a great question. I think modeling at this point in time is very difficult. Even at the best of times, with the best of information that we have, it's very difficult. But the difference that we have in this situation is we are facing Omicron for the first time in, I guess, the planet's history at the same time as other jurisdictions have. Previously, we were learning from other jurisdictions. So we're learning in real time the behavior of Omicron in a manner that we didn't face, for example, with the first wave or really any of the other waves, including Delta. So whether it's 1%, 0.1%, more or less, these are clearly going to be just guesstimates. I think an important thing to understand about modeling, and I'm not a modeler by any stretch of the imagination, but modeling is meant to give governments and other actors some idea of what could happen. And I guess in this situation, the government is facing a situation where it is possible that we will get a massive number of patients that will absolutely overwhelm the system. Certainly what we're seeing right now is just the beginning of the lagging effects of a massive increase in infections. If we assume that countries like Denmark and the United Kingdom were ahead of us, then we can be reassured. But I'm not that certain, to be honest with you, that they're much ahead of us. And so we're really learning in real time. And so I am concerned that we're going to have large numbers, but that magnitude is really unclear to me, that's for sure. And I think it's unclear to the government as well.
All right, let me follow up with Dr. Mubaraka on this. If there's two things we've heard about the Omicron variant, it is one, that it's much less deadly than the variants that came before it, and two, that it is much more transmissible than the variants that came before it as well. Speak to us, if you would, about the second point. Why has this variant become so much more easily transmitted than the previous variants?
So it's most likely multifactorial. In other words, there's probably more than one component or one contributor to the fact that it's more transmissible. If we look at it from a virology perspective, there's some recent data out that shows that it replicates really, really well in what we call primary nasal epithelial cells. So those are human cells from the nose that people grow up in the lab. And when you compare and actually do a competition between Delta and Omicron wins hands down. It replicates really, really efficiently in that type of system. So already we're seeing replication fitness, and we're seeing it more so in the upper airway than in the lower airway, because that wasn't the case when again, this is all very in vitro and experimental and a model, but not seeing that really in the lungs. So that might be one thing, is that people are just shedding high amounts of virus from the nose. And I think that it's really important to correlate that with what we're seeing clinically. That would be very, very helpful. And then the other issue is one that we've already touched upon, and that's immune evasion. We know that neutralizing antibodies are less effective from prior vaccination against this virus. So if that's the case and there's immune escape, then it makes the virus much more transmissible. Now, we haven't pinned down exactly which mutations are responsible for this. I mean, this virus is really divergent. It's so different from the other viruses we've dealt with. There are over 50 changes across the whole genome. Some of them are familiar to us. They were present in Alpha, they're present in Delta. Some of them are new, but the behavior of this virus in cells is different. We know it's getting into cells through a different route than the other ones, but we really don't know which mutations or which combination of mutations are responsible for that. So I think that'll be a major focus in the weeks and months to come.
And Dr. Morris, a follow up with you. We know that people who have not been vaccinated are more likely to have more serious after effects if they contract this variant, the Omicron variant. But I wonder if you could talk to us about some other aspects of it. For example, who's the most vulnerable? Is it still older people? Is it still poorer people? Is it still people in particular demographic or ethnic groups? Help us on that, if you would.
Yeah, it's really challenging. I think a few things. The one thing that we're seeing on the front lines is that we're seeing chronic illnesses being exacerbated by Omicron, which we didn't see before. I don't think we know exactly why that is. It may be that this is just how Omicron is acting, but it's also possible that people who are comfortable with their vaccination status and have chronic illnesses are letting their guard down, where, for example, a year ago, they may not have let their guard down as much because they were more worried. We are still seeing people, especially who are older, with all the additional traditional risk factors like comorbid illness, obesity, social vulnerabilities that you alluded to, they are still ending up with very severe disease, and we're seeing that right now. So we are seeing patients in the ICU with Omicron disease that is exactly like what we saw previously. So that really hasn't changed. I think the one thing that everyone's talking about is, because it's so highly transmissible and because so many people are well protected by their vaccination or to some degree by prior infection as well, that we're seeing lots and lots of mild disease, the runny noses, the stuffiness, the headache, and we weren't really seeing much of that previously. So that's been the real difference. But I think one thing that we are seeing in Ontario for sure is a change geographically, so that some of the communities that weren't as hard hit previously, they aren't nearly as well protected from immunity. And so we're seeing more outlying areas, not the urban areas, that are being more substantially hit. This is going to cause us increased problems in terms of healthcare delivery, because they just don't have the systematic organizational resilience that the urban centers do. They just don't have that capacity, and that's going to cause a real challenge in the weeks ahead.
And let me do a quick follow-up with you on, again, the integrity of the numbers. One of the things, obviously, the people of Ontario need to know that the numbers that they're getting from their Ministry of Health, from the government of Ontario, are numbers they can believe. But we saw the mayor of Brampton, Patrick Brown, say the other day that there are people who end up in hospital with COVID, but they're not in hospital because of COVID. They may have got COVID, but they're actually dealing with other more serious things. And yet those numbers are being added to the COVID numbers as if to suggest, well, the suggestion seems to be that COVID may be a bigger thing because of it than it really is. Could you speak to that, and whether or not the province needs to start taking more care to tell Ontarians who's in hospital with COVID versus because of COVID?
I think it's an important question to ask for sure, because if everyone in the province has COVID infection, clearly not everyone who's being admitted to hospital is being admitted due to COVID. But the reality is not everyone in the province has COVID. And we do have patients who are being admitted to hospital without COVID. It's very difficult, unfortunately, to clearly differentiate it for many of these patients, as I've already pointed out, what is due to COVID and what is with COVID. I think for most of the pneumonias that we're seeing, that is lung infections and people who are needing oxygen and possibly ventilation support, it's pretty obvious that that's due to COVID. But these exacerbations of chronic illnesses that we weren't seeing previously, it is really difficult to tease out. And most of us on the front lines are now struggling with this. And one thing I'll also point out is not only are we struggling to understand whether that's due to COVID or with COVID, but we also don't have as much confidence in knowing the effects of the treatments that we've been using for COVID up till now, and understanding whether that's going to help those patients get them better sooner compared to the COVID patients, where it's much more straightforward.
Okay, back to the political angle, and Rob Benzie, come back in here for this. Understandably, the Premier, the Minister of Health, sometimes the Minister of Finance, really dominate the microphone, if I can put it that way, these days, because they're the decision makers and they're the ones who really have the most influence on what we do. However, you and I both pay attention to this thing. The opposition parties also have a role to play in our democracy, and they have been holding virtual news conferences online every day, every other day for quite a long time, for many, many months, saying, here's where we think the government has made mistakes, and this is what they should be doing, and what we would be doing if we were in charge. Can you put some meat on that bone and tell us how they might be doing things differently?
And you know what, Steve, it's significant because remember, we have an election in Ontario on June 2nd. So 5 months from now, we'll be at the polls. And I think because of that, Andrea Horwath, the NDP leader, Mike Schreiner, the Green leader, and Stephen Del Duca, the Liberal leader, have more of a microscope on them than they normally would. I mean, you and I both know it's very difficult for opposition leaders to get any oxygen in the media or in the public realm unless it's in election time. Well, we're in the run up to that now. So we're going to be seeing a lot of Ms. Horwath, Mr. Del Duca, and Mr. Schreiner in the weeks and months ahead. And this is one of those times when it is really, really difficult and challenging to be in government because the Premier Ford is rightly or wrongly being second guessed for everything that he does, and that's the drag of being in government. Justin Trudeau found that as Prime Minister when he ran a campaign last fall, he was getting second guessed, and who knows, if Omicron had happened, maybe the election result federally would have been different than it was. I don't know. So this has thrown a spanner in the works for the Tories because they had hoped to be talking about building up after COVID, rebuilding the economy. And instead, they're talking about another wave of this pandemic that everyone is fed up with. Everyone is looking for someone to blame, even though there's no one person that can be blamed. This is a worldwide thing that's happening everywhere. And every government in every country is challenged by it. But we are where we are, and the Tories are where they are, and they have an election in 5 months, and they have to get they have to get through Omicron. I don't know if they will. And then they have to pivot to talking about what could be like if they're reelected. If you're Stephen Del Duca or Andrea Horwath or Mike Schreiner, you can be saying, look, here's what we would have done that's different and would have been better. I don't know if it would have been better. I don't know actually how much different would they be listening to different doctors and a different science table than Premier Ford is? I don't know. But I'm pretty sure, just judging by what's happened in Quebec and in Manitoba and in New York State and in Michigan, that it's really, really challenging, whoever the personalities are, whatever political party is in power. So I'm not really sure it'd be that different. I was speaking with a senior Liberal the other night who was saying that, oh, well, we would have managed this better because we wouldn't have had strife with the teachers' unions and we wouldn't have had strife with the nurses' unions. That's possibly true, but I don't know. They might have had strife with the business community. I mean, Doug Ford is taking a lot of hits from the Canadian Federation of Independent Business, the Chamber of Commerce, and others for these lockdowns, quasi-lockdowns, whatever you want to call them. And would Kathleen Wynne as Premier have been even more criticized as being anti-business? I bet you she would have been, Steve.
Well, as an example, we've heard all the opposition leaders come out and say that were they in charge, they would have, and I know the Premier says this all the time, that he'll spare no expense and spend every penny required to do this, but they allege he hasn't. And they said they would spend the money required to, for example, make class sizes half as big as they are right now in order to prevent the kind of spread that might be taking place in schools. They have said, for example, they would spend more money on HEPA filters for classrooms so that the air circulation is better. These are a couple of the ideas. When the medical officer of health came out last week and held that press conference without any government representation there at all, Stephen Del Duca, the Liberal leader, said that the Premier's missing in action. Now, these are the kinds of lines that opposition parties will use. You've looked at this. Do they have some credibility when they make these allegations?
I mean, well, sure they do, in the sense that you can say, well, yeah, it would be better if we had 15 kids in a classroom instead of 25 kids in a classroom. But there's 4,000 schools in Ontario. So that means you have to build all these new classrooms and hire all these new teachers who you can't just, open a vault and say, here's a 10,000 teachers we can hire. I mean, these teachers have to be trained and they have to be paid. And Ontarians may have to pay higher taxes for the things that that they are needed. And maybe Ontarians are willing to do that. I don't know. I mean, like, we haven't talked about long-term care yet. That was the crisis of 2020 and 2021, and the government has thrown a lot of money at long-term care. The long-term care minister, Rod Phillips, is on the front lines, working very hard in that sector. But it's going to be there's a big bill that comes with that, and that's something that governments, whether they were Tory, Liberal, or New Democrat, didn't really want to address, because nursing homes wasn't really the sexy thing to invest in when you could invest in cancer or kids' hospitals and things like that. So I think this is the thing that's going to be challenging for any government, regardless of who wins the June 2nd election. And Steve, I have no idea who's going to win. I wouldn't want to surmise who could, but whoever is the premier on after June 2nd is going to have a big challenge, a healthcare challenge, a societal challenge, a mental health challenge. I mean, I think it's going to be very, very tricky no matter who wins.
Indeed. All right, let's, in our remaining moments here, I guess we got 5, 6, 7 minutes left. Let's take a look forward. And Dr. Mubarak, I'll start with you first, because I know everybody's thinking to themselves right now, how do we get to the finish line on this thing? And I know there are a bunch of different theories on this. One way, presumably, would be to have 100% of the population vaccinated. That would be lovely, but I'm not sure that that's in the cards anytime soon. The other option, I guess, is to let this current variant just kind of burn its way through the population, knowing that it's a lot less deadly than its predecessor variants. What's your view on that as an option going forward?
Well, I think the concern, if we just let it run through the population unchecked, is that, again, we will still have, even though it might be a small proportion of individuals who get really, really sick, it's still enough that it would potentially overwhelm the healthcare system. And absenteeism is something that's been highlighted here, and not just among healthcare workers, but think about the rates of absenteeism among, teachers, people who, essential workers along the supply chain. So many different sectors would be affected. So from my perspective, I don't know that would really be the best option because of the knock-on effects of doing that. Obviously, we need to continue with our current vaccine strategy, and I think we need to start thinking about other vaccine strategies. Like this might be the trigger. This might be the one that the first time that we actually switch out the S protein for maybe a more specific vaccine. Up until now, all the vaccines have really contained what we're calling the ancestral or the parental spike from way back, like late 2019, right? And it's been difficult to know whether we should update the vaccine because it's been one variant after the other. You would no sooner switch it out than the next variant would come along. So that's the pitfall there. I'm not saying that that's a panacea by any stretch of the imagination, but we need to keep a really, really close eye on vaccine effectiveness going forward, not just for infection, but also hospitalization, and maybe make a call in the very near future about whether to change the vaccine. I think we're going to be entering a phase of what we'll call endemicity. There are a few hallmarks that we've already reached when it comes to that. It's already spilled over into animals. We know now that deer in Quebec are positive for SARS coronavirus 2. So the likelihood that we will eliminate this is unfortunately very dismal. This is not like SARS 2002 where it came and went. This one's here to stay.
Well, on that front then, Dr. Morris, let me ask you whether or not we are at the point where we need to start thinking about the Omicron variant as we do the regular flu. It's endemic. It's going to be with us all the time, and we're just going to have to learn to live with it.
Yeah, it's a nice thought. I think the challenge we have, I'll correct myself, I think one of the biggest errors we've made is we've consistently tried to use the flu paradigm and apply it to COVID-19 or SARS-CoV-2, the virus. And I think that has failed us repeatedly in almost all facets of how we've tackled this. In many ways, it has not behaved like it. It's a different virus. It mutates differently. Our response to it as humans has been different. And I think it makes it very uncertain how we're going to be able to move forward. we will. All pandemics do end at some point, and likely it's going to be some degree of luck in terms of how the mutations move along with the virus, as well as our population-based immunity, whether that's going to be from infection or from various vaccination strategies. I think the one thing that we should probably take home from this point forward is that we need a much more robust approach to breathing clean air and making sure that all the various workplaces and places of recreation are as safe as possible to minimize transmission. And I think the other thing that's really important for us to appreciate is that it's really never a good strategy to, from an infectious disease perspective, to try and optimize infections. We've never done that before, and I don't think that's probably a good way moving forward. So it's probably best to have a vaccine first strategy, but also try and ensure that we have all places, homes, schools, workplaces, recreation centers, as safe as possible. And all those things moving together in lock arm will probably minimize the damage that this virus will have moving forward. But I think it's really unpredictable how this is going to play out. COVID-19 has surprised us repeatedly. And I think what we should take as a truism is that it will continue to surprise us moving forward.
Well, I wonder if one of the potentially happier surprises down the road is the use of antivirals, monoclonal antibodies, that kind of thing. Maybe I don't know, you tell me, is that a lifeline that we should hang on to, that maybe it won't be vaccines via needle, but maybe via tablet at some point down the road?
Well, I think that all the therapeutics have proved to be, in many ways, better than I even hoped, to be honest with you. The challenge we have right now, not only in Canada, but internationally, is one, the supply of it is still very, very limited. Even our existing therapeutics are running dry at present because the demand is so high, and not only our local demand, but the international demand. And we're a relatively small player in all of this. That will change over the coming months for sure. But the new antivirals, especially the Pfizer product, is definitely promising. We're not going to have tons of it in the next while. I'm not even entirely sure when it will be approved. The federal government allowed the early use mandate to pass, so it has to go through regular approval process. So it's a reason why it's been delayed. So we're not going to have tons of it. It's unlikely that it's going to make a difference in this wave. If it is, it's going to be a very small difference. But moving forward, I do think that all of these are going to be very promising, and we'll probably have even more therapeutics moving forward.
And one last question about politics to Robert Benzie. I got a text on the weekend from somebody, Robert, who said to me, I don't know why Doug Ford doesn't come to the podium, get behind the microphone, and simply say, look, I'm paid to make these decisions. I'm making them the best way I can. If you don't like them, we've got an election in 5 months and you can take it out on me then. But in the meantime, I'm going to do what I think is right. Can you imagine this premier saying something that direct to the people of Ontario?
Yeah, I mean, he sort of said something to the effect of, I had to make this decision, and I was decisive, and it took 30 seconds, and he was derided by his political rivals for being so impetuous. And Stephen Del Duca tweeted a picture of himself with a pizza, saying it took 30 seconds to order this Pizza Hut pizza, which I guess is a cute thing for his supporters. It's tough, though, Steve, to say, because as both the doctors have said, this thing has evolved so much over the last 22 months, and I can't believe that I'm saying it's 22 months, but it has evolved so much, and there's been so much said, and we've always thought everything was a magic bullet. Paid sick leave was going to be a magic bullet. Vaccines were going to be a magic bullet. Masks were going to be a magic bullet. Social distancing was a magic bullet. HEPA filters in schools, a magic bullet. Everyone's been looking for a really simple solution to this, and I don't know if it's antivirals or antibody testing or whatever, rapid tests. I think the problem is there is no magic bullet. This thing is really wily, and I believe we will get through. As Dr. Moore says, all pandemics end. This isn't the worst pandemic in the last 120 years. It just isn't. The Spanish flu of 1918 to 1920 killed 50 million people. This one has killed, I don't know, worldwide 3 million. In Ontario, 10,700, 10,800, something like that. That's terrible, but it's not. It hasn't been as catastrophic as past pandemics have been. And when this one is over, I think we'll look back and we'll learn some things from this. But I have a feeling that we might forget a lot of the lessons of this pandemic, the way that we've forgotten the lessons of previous pandemics, whether it was SARS in 2002, 2003, or the swine flu, or the Spanish flu. So I don't know. I'm hopeful that this will end sooner rather than later. But I, like everyone else, I'm weary and kind of fed up, Steve. I got to tell you.
Robert is hopeful and fed up, but I am just grateful that the three of you could spare some time for us tonight on TVO. In the middle, Dr. Samira Mubaraka, and on the bookends, Dr. Andrew Morris and Robert Benzie. Great to have you three on TVO tonight. Thanks so much.
Thanks for having us.
Good night.
It goes without saying that everyone had hoped there would not be another wave and another round of restrictions as we face yet another month of this pandemic. How can we confront COVID-19 fatigue? Let's find out as we're joined in Calgary, Alberta by David Dozois. He's a professor of psychology at Western University. And Professor, it's good to have you on our airwaves again. How are you doing tonight?
Thanks. Nice to be back. I'm doing well, thanks.
Good to hear. Let's start with this. What's a normal reaction to what we as a province are all experiencing right now?
Well, I think given the pandemic and unfortunately the next wave and the Omicron variant, I think people are experiencing, understandably, a lot of anxiety because we've been a bit on a roller coaster. We thought this was over. We thought we could see light at the end of the tunnel, and all of a sudden, I think we're starting to face yet more restrictions and lockdowns and an increase in cases. And so it's worrisome. And I think some people are at a point where they're just fed up and feeling a bit demoralized by the fact that we're once again on the roller coaster with this.
Fed up and demoralized makes a lot of sense, but I'm wondering if there are more that you can tell anyway, more long-term adverse effects that would be sort of, going years forward, much more problematic than the adjectives you have just used. What do you think?
Yes, well, I think the pandemic itself has created certainly a lot of anxiety and depression. And I've been involved. I'm on the board of directors for an organization called Mental Health Research Canada, and we've conducted polls across the country in both official languages. We've conducted now 9 polls, and we're continuing on. So we started this just when COVID-19 first hit, and what we found is that anxiety. For people who said anxiety was high or extremely high, about 5% of people said that, and that went up to about 20%. So from pre-COVID to when COVID started, and that level has maintained over the course of the different polls we've been conducting, regardless of whether restrictions are lifting or not lifting and that kind of thing. Depression went from about 4% to 10% at that time, and unfortunately that has been trending upward. And so I suspect not only will we have what some researchers call an echo pandemic of mental health issues, but we're going to experience a lot of anxiety and probably depression down the road, partly due to the pandemic itself, but I think also due to social isolation and other variables.
Just to put that into some kind of perspective, are those the kinds of increases you would traditionally see? And I don't know, you fill in the blank here, on 9/11 or in the event of a world war or, I don't know, someone goes through a divorce or a death in the family. You tell me.
Yes, that is true. I think there is an initial response to that, and certainly with other variants like SARS, when SARS hit a number of years ago, certainly there were mental health repercussions of that. And the good news is I think that society does tend to bounce back. And for the most part, I think Canadians are quite resilient. But nonetheless, there will be a pocket of individuals who are more vulnerable to anxiety and depression who will experience long-term effects of this.
Well, I wonder again if one of those long-term effects is some kind of adverse consequences to our memory banks. Does this affect the brain in such a way as to make people not be able to remember things they normally would?
That is a common experience. Certainly, I think last year when you asked people how they're feeling, I think most people said they're stressed or they're worried or they're lonely. And now you get more responses like, I feel burnt out, I feel exhausted, I feel depleted. And I think those brain fog or memory issues is a common response when we have an increase in a cognitive load. So when our brains are full of information, and in part they're full of information because of COVID-19, we're worried a lot more, and so our brains are processing so much more information than it normally would. We tend to, for some people, they may be ruminating or stewing about COVID and might I get it? Will my family member get it? Those kinds of things. And I think that creates almost an issue where we're having to constantly process a dual process. We're processing in the back of our minds all this worry, and then at the same time we're trying to focus on our tasks at hand. And so certainly there is memory difficulties, indecisiveness, concentration difficulties, and those kinds of things. And I think anxiety and depression as well contribute to that. Those are common symptoms of anxiety and depression. Concentration difficulties, lack of motivation, low energy, feeling a bit more indecisive or more confused or more tired or burnt out.
The one thing I hear, perhaps more than any other, and I wonder if you do as well, is the complete, how would I describe this here? People's sense of time is lost. They just, they don't know what day it is anymore. They don't know what month it is. They don't know how long this thing has lasted. Has that been one of the consequences you've seen as well?
It has. In some ways, I think it's a bit like Groundhog Day. I think with lack of structure in our day, many of us were working from homes. Many of us still are working from home. And so, the days tend to blur into each other, and it becomes a bit, as I said, like Groundhog Day, and you kind of forget what day it is. I know my parents have a thing where they flip the card each day to remind them what the next day is. And I know some news organizations have been kind of announcing it's, whatever day it is, and they remind viewers of what day it is because of that very thing. I think part of it's that we're lacking structure in our day, and we're lacking the things that the frameworks that usually remind us and keep us on tab in terms of where things are at.
Let me ask you about what I presume is a kind of a technical term in your line of work, and that is caution fatigue. What is that?
Yeah, caution fatigue is really, in many ways, I think, essentially where we get to a point where we're tired of restrictions and we sort of let our guard down. So when COVID first broke, I think what happened is many people were anxious, were very concerned about, will I get it? Will my family members get it? How long will this last? How contagious is it, and so on. And what happens when we experience anxiety like that is our bodies kick in this very adaptive process called the fight or flight response. And so our bodies are prepared with increased heart rate, more oxygen to our bloodstream, and so on to prepare to fight or to get the heck out of there. And what happens when that alarm system gets triggered and activated for so long is eventually you get to a point where the body goes into a bit of exhaustion and you're tired of it. And so part of the issue in some ways is once we face our fears, our anxiety starts to go down. I practice cognitive behavioral therapy, and so this is a very effective form of psychological treatment for a number of different disorders. But for anxiety, for example, if I'm treating someone who has a fear of dogs or a fear of social anxiety, fear of public speaking, I would have them face their fears bit by bit and do what we call exposure so that they can change their thinking and so that they can habituate to what it is that they fear. The double-edged sword of COVID-19 is we've been facing this alarm system's been active for so long. We've been facing it for so long that we've sort of habituated to it, even though it's a bit dangerous to habituate to it. This is still an objective threat, and we need to be careful not to let our guard down. So caution fatigue is really letting our guard down. The World Health Organization talked about it as almost being, kind of lacking in energy because of COVID-19. And so we're more apt to slip up and let our guard down, do things that are really, quite frankly, more dangerous.
Okay, so you've described the impact of that on an individual in our society. Now let's assume what you've just described multiplied by 15 million. Right? Let's assume that, or at least a big chunk of the people in the province of Ontario are experiencing this right now. Can you talk to us about what the societal-wide implications are for a huge, millions potentially, a huge number of people experiencing this all at the same time?
Yeah, I mean, it's very dangerous because when we need to balance anxiety. On one hand, I think sometimes people are a bit over vigilant about COVID-19 and it's causing a lot of anxiety and worry. And on the other side, I think sometimes people are more nonchalant about it and not taking it seriously enough. And I think the danger of that, of course, society-wide, is that there still is, the threat out there. COVID-19 is, you've seen the cases. They've been jumping really high of late. And the Omicron variant has really been spreading. And so the danger of caution fatigue is that we're letting our guard down. And what's happening is that it's more easy to have people be careless and therefore start spreading even more and creating new variants, essentially.
Now, obviously, not all 15 million Ontarians can go see a therapist if they think they're experiencing this. We simply don't have the capacity to handle that kind of workload. But
right.
If people watching or listening to this right now think they are in that boat, what do you recommend?
Well, I think there's, in some ways, I think there's three main things for caution fatigue that would be helpful. One is kind of keeping your thinking in check. Another is maintaining an attitude really of social responsibility. And then the third thing I think is to learn to better manage stress. So in terms of keeping your thinking in check, I think it's really important for us to be evidence-based in our thinking. It's very easy for us to think with our emotions or let our emotions drive what our behavior or what we're feeling rather than kind of sticking to the facts and thinking. So it's very easy to, for example, think the sky is falling, or as I mentioned before, it's very easy for some people to be nonchalant and think, well, I haven't experienced COVID yet. My chances are low. I'm not going to worry about it. But the problem with that is, of course, we're creating the very problem we're trying to avoid. And so I think part of the solution to caution fatigue is always being evidence-based in our thinking and making sure we're focusing on what we need to be doing, our provincial and local health regulations, washing our hands, maintaining distance, getting that third booster shot if you haven't already, or getting vaccinated if you haven't already. I think the evidence supports that, and we need to be evidence-based in our thinking. The other thing is to act beyond yourself. I think we often, it's so easy to think about your own needs. I've missed connecting with people. I've missed getting together with loved ones. I'm gonna risk it at this point or something. And it's so easy to do that. And I think it's really important to think beyond ourselves and recognize that we have a social responsibility. And we need to think in particular about people who are vulnerable or elderly, who are more at risk if they do catch COVID-19. And then the third thing is to really better manage stress. I think we're better able to adhere to restrictions and be compliant when we're feeling like we're on top of things and when we feel like we're able to manage stress. And I often view stress as almost like water in a jug. If the water level gets too high, it's very easy for a little hit on the jug for the water to just splash all over the place. And if we can do things to lower the water level in the jug, then it can take a hit and it can slosh around, but it won't spill everywhere. And those are things like eating well and maintaining good sleep patterns and keeping your thinking in check and making sure you're active and doing things that, that are rewarding and enjoyable.
That's a nice metaphor. Where do you think the water level is in the jug that is the province of Ontario right now?
I think it's pretty high. And I think it's pretty high both in terms of anxiety about COVID-19, but I think it's pretty high in terms of people feeling sort of demoralized and tired of restrictions, quite honestly. I think, we're social creatures and we want to connect with people. We're kind of wired to love and be loved and to connect. And so when that's missing because of restrictions, it wears thin, understandably. But I think part of it is recognizing there is light at the end of the tunnel, and we're almost there. We just need to kind of keep pushing and do what's right so that we can reflatten the curve.
Just finally, in our last minute and a half here or so, and let me set this up by saying I don't mean this to sound like a snippy question, because I know people are dealing with a lot of very serious issues out there right now. Mm-hmm. But there are some among us who lived through World War II, the so-called greatest generation. And they may look at the kinds of things that people are, frustrated or complaining about today and say, we had bombs raining over us in London, for 40 straight days. And, some of you people are complaining because you've seen everything on Netflix already. You want to talk to us about perspective for a second?
Well, it's good. I remember reading once that, something, I think it was on Twitter, where someone wrote, people sacrificed their lives in World War I and II so that I can have my freedom. All we need to do is sit on the couch. All we need to do is adhere to some restrictions. It's not that difficult. So I think we do need to put things in perspective and recognize that this is very difficult. It's difficult worldwide, of course, and it's infringed on our freedom and our ability to have more control than we normally would. But at the same time, I think we need to recognize that it's, realistically, it's a pretty small sacrifice to make for the greater good, and so that we can put this behind us and then move on with our day-to-day lives and to the things we really enjoy and have loved.
Amen to that. Professor David Dozois, Professor of Psychology at Western University, which is in London. He's joined us from Calgary, Alberta. Professor Dozois, it's always great to have you on our program. Take good care, and we'll see you again down the road.
Thanks so much. Take care.
And that is the agenda for Tuesday, January 4th, 2022. Tomorrow, author Mia Bloom explains the corrosive effects of the QAnon conspiracy theories on its own believers and the countries in which they live. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
The Agenda is always on. To catch up on conversations from this week or any week, visit our website, tvo.org/theagenda, or our YouTube page at youtube.com/theagenda. It's all there for whenever you want to watch.